Hi everybody, I'm Dr. Qazi. I'm a skin restoration specialist in Newport Beach, California. I focus mostly on acne, on scars, and pigmentation. I do a lot with facial balancing as well. I'm going to walk you through this particular case. I love this case because this is something that I do a lot with rolling scars, and then we have to do with volume replacement. And you can see, just look at that significant improvement over here. For this particular patient, it's awesome. This is something that we were able to achieve in this case with a few different things. Number one, we wanted to actually do something where we broke up the scar tissue with subcision. And then we also ended up doing some laser. We did some TCA Cross. And in this case, we also ended up doing some Sculptra as well. So Sculptra worked out really, really well for this patient because he had so much volume loss. So this is something that I like to show for people that ask about how important is volume replacement. Do I really need to do volume? And here's a case really where it showcases really, really clearly why we need volume. And when we don't have volume, you're really not going to be able to achieve like that full effect. Hi, Mrs. Jones. How's it going for you? Luciana saying, how can I schedule an appointment? Well, there's really an easy way. You can just go to my website, go to drqazi.com, and you can schedule it that way. Actually, that's actually a pretty good way of doing it. Just go to drqazi.com, and you can schedule it that way. Otherwise, you could call our office, of course. But at this time, really the easiest thing is just to go that way. Thank you so much, TikToks. It's Tik2Toks. What's the best treatment for scars on my temples? Probably the best thing, I actually showed it last week. I was showing a patient a case where there was a lot of volume loss over here, and we were able to actually improve it with Bellafill. Temple area really quickly loses volume when you have scars. So basically think of it like the acne is there. And then when you have acne, essentially what ends up happening sometimes is that it could destroy really, really quickly your fat underneath there. And if it destroys your fat, then you really can actually get it so that it's scarred itself. And even if you lose weight, or sorry, I should say you gain weight again, that doesn't necessarily go in those areas where you had that acne and the scars. And so sometimes we really do need to give volume replacement. And in this case, that's what we ended up doing. This is a patient who had tried multiple different treatments before, did laser before. Nothing was able to achieve these kind of results. We were able to solve this or get close to solving it with volume replacement here. Thank you guys, appreciate you. Shamens is saying, how do you treat hypopigmentation? What's the cause of the hypopigmentation? That's really the biggest thing. If it's more from like lasers, sometimes that's really where we could do UV light to actually improve it. And then of course you want to make sure that you do something where you protect the rest of the skin while you're doing that. Sometimes you could actually do treatments like Tacrolimus also could potentially wake up the pigmentation. So that's something else to consider. Tacrolimus could be a good option as well. Did you use Bellafill? No, actually in this case I used Sculptra because there's so much volume loss. He actually didn't have any fat for me to take his fat, but he would have been a great candidate for fat transfer as well. He had so much fat loss there. Hi, Alan. How's it going? I heard that you're coming in soon too. Elerma is saying, do you prefer the Teal Liberator versus cannula and why? Most of my work is done with blunt cannula, mostly. In fact, actually, sometimes I was surprised actually today. I had some thicker scars that I was working on. I really thought that I was going to end up needing a Teal Liberator, but I was able to really break that up really, really well with just blunt cannula. And so, it's there in my arsenal of tools. If I need to, I'll use it. But a lot of times people don't actually need it because I can actually break up that scar tissue really well without it. I only use it if I really, really need to. And then it's more for like localized spots. Why can we not figure out how to get rid of cellulite? So cellulite is actually very similar to scars themselves too, because there's a lot of times it's a component where it's tethered, it's stuck, and you actually have to break up that tethered bond, and that requires subcision. And that's why like just minimally invasive tools, minimally invasive procedures don't work really well for cellulite. It's not going to help enough for cellulite really. So instead you actually have to go in there and manually break up the scar or break up that cellulite band. And then there's also this fat loss a lot of times inside that pocket there too. And when there's that fat loss, you actually have to do something else where you do either fat transfer or you do filler, potentially like Sculptra, Bellafill, all options there for that. Blue saying, I got hyperpigmentation after a laser. How should I fix it? Number one is to use sunblock, of course, just the first step. We always use sunblock. But number two would really be that you could be on some sort of skin brightener. You could potentially try to consider something like hydroquinone if you need to. Something else you could just get over the counter is Eucerin's anti-pigment cream. That works out as well. But you may need to be on a stronger cream like Triluma, or you could actually do a laser like the Pico laser, works very, very well for post-inflammatory hyperpigmentation like that. Fifi saying how to get rid of years of large areas of hyperpigmentation from eczema. So again, potentially laser could help, but usually you want to start with something else like really you want to start with more like creams, typically hydroquinone. You could try Eucerin's anti-pigment cream. All good options there. Hey Carlos, how's it going? Good seeing you over here. What do you mean that things aren't going well over there? Carlos, good seeing you. Thanks so much. Carlos has been doing scar treatments. He's been doing really well. I just saw him a few days ago, and really, really nice actually, really soft actually already. He's looking forward to building out his jawline at some point. Also on the meso aesthetic, do you carry it without tint? Yes, we do actually. We do have that without tint as well. But the one with tint is really, really what I recommend for patients with melasma, with hyperpigmentation. So yeah, definitely. Lucky Singjada saying, hello, Dr. Qazi. Have you done any work on Miss Yamara? Are there any updates on her? What treatments would you do for her? Thank you. So yeah, she's she's gonna come by at some point. I think she's gonna at some point we'll work with her to help out with her skin. She's somebody I really look forward to seeing. My schedule was really full though for several months. She also had to be able to take some time off really to come by, but I know that she was talking to the team actually today even to see when she could schedule that. So hopefully that'll come soon. And I'll be happy to help her. But basically, a lot of what she's going to need is excisions. It's going to need volume replacement. A lot of what she needs is volume replacement. How to get rid of flaky scalp? I've done everything. Well, if you did anything, do you mean like you've worked with somebody to make sure that there's not like this fungus that's on there? You want to make sure that you worked with someone for the yeast. Something like ketoconazole would be a really good option. You could just get 2% over the counter, do that for 2 weeks. And then just sometimes what people don't realize is that you still want to do it at least once a week, regularly do it once a week. And then on top of it, you could consider something like actually even Head and Shoulders actually the rest of the week actually could potentially help you. Nash is saying, hey man, I was in a car accident. How deep of a scar do I fix it post-trauma and scar surgery? It depends. I mean, it depends on, I'm sorry you were in that car accident. What kind of scar is it? Is it just from hyperpigmentation? Is it really just that it's really pulled down from fat loss? If it's more fat loss, you may have to do things for volume, for fat replacement. I can't really say exactly until I see you, but I absolutely can work on that as well. Shamans is saying, how to determine if atrophic scars on the nose need subcision? Well, it's unlikely that it would be something that we would do subcision. I had a patient yesterday who had a big boxcar scar, and we ended up just placing a little bit of Bellafill over there. That works out really, really well sometimes for patients. You don't necessarily have to do really subcision for the nose. It's not probably going to help too much. Trixie is saying, hi doc, how much is a treatment like this ballpark with you? So this is more complex. This was involving subcision. In this case, I did do Taylor Liberator subcision. It involved ablative CO2 laser for the edges of the scar. It involved Sculptra as well. So this was a few different steps for this particular patient. This would be something that could cost about $7,000 to maybe sometimes $10,000 depending on how much volume is there. Kimberly Roman is saying, can you explain the difference between Tretinoin and Clindamycin and Benzoyl Peroxide? Sure, actually, that's okay. So I'll start with Benzoyl Peroxide. Basically, I don't really love it, but I'll start with that. But that's basically a way to kill some of the surface bacteria that's living on the surface of your skin, and not as an active, actually antibiotic, but just something that's just going to kill it by because it's a bit toxic for the bacteria. Then there's Clindamycin. That's the actual active antibiotic. So you could actually combine Clindamycin with benzoyl peroxide. It actually works very well. Sometimes it could dry up the skin a little bit though. But that actually is nice because it doesn't cause as much antibiotic resistance as doing Clindamycin by itself. My own personal favorite though is to use Clindamycin with Dapsone, or instead of benzoyl peroxide, I use Dapsone. The reason why is that I find sulfur to be a much better medication than benzoyl peroxide. And plus we see a lot of different issues with benzene now. There's a lot of different companies that are pulling their benzene off the market because there's a concern that it could cause cancer. There's a possible link with that. So that's why I tend not to use it. Tretinoin, these retinoids, those are really things that are going to help with the oil production that could cause acne. It could stimulate a little bit of collagen as well, but those are really the big things actually. So all those actually you can work on for patients. A lot of times I don't overly dry the skin, so I tend not to do tretinoin at the same time as I'm using something that is drying, for example, like benzoyl peroxide. But tretinoin and adapsone could be a good idea. That could be a good combination. Keither is saying, hey doc, how effective is 15% azelaic acid for uneven skin tone and discoloration? It's mild. It's not going to help enough really for the vast majority of patients. It's a pretty mild solution for a lot of people, but it's worth giving it a shot. You could just get at home over the counter 10% actually could work well for you. Faria is saying it's been 6 weeks of tretinoin, no results. I'm not sure what kind of issue you're trying to solve with tretinoin, but you probably could up it, depending on what the dose was also. And then on top of it, if it's really scars, like something like this, for example, this is not going to get solved with tretinoin. You're going to have to do other treatments really. It's not going to be really something that a cream is going to solve. Nimisini is saying, hi doc, thoughts on FX laser and BBL halo laser? For what kind of treatment? What are you trying to solve? If it's more for just like pigmentation, that's different. I'm not entirely sure. David Kuhn is saying, is subcision less effective without filler? Also, how common is sagging? So it's not really done with filler like at the same time unless we really have to do it like in certain pockets. Vast majority of the time, I'm going to break up the scar tissue really effectively, and then we'll see where that volume loss is, and we could determine if that's something that we will put some volume in usually afterwards. Sometimes I may do a little bit of Sculptra at the same time. Sometimes I could do like a little bit of Bellafill at the same time, but I usually don't overdo it really that time because I really want to keep it looking really natural, like looking really soft forever. It's really, really important that when you're smiling and animating, it's going to look great. And it looks very different when it's swollen compared to afterwards. So a lot of times I will break up the scar tissue, and then we'll see you later on to be able to do some volume replacement. But certainly it could be an option if it's certain areas, especially like the mid cheek works very, very well if we do subcision and we do some Sculptra at that same time. What do you recommend for cystic acne? So usually you want to make sure that you can control the bacteria component a little bit better. So you may want to be on an oral antibiotic for that immediate breakout. And then what we do is actually we do the Accure laser, which works on normalizing acne, normalizing the oil gland that causes acne. And then we can also do isotretinoin or Accutane really to help prevent acne in the future. So it depends on how severe the acne is, depends on how much oil production you have. But if we need to, we can actually do, all those different options. It just depends on like how long you have in terms of like recovery wise. Accutane sometimes really is something that could take like 6 months, a year to really kick in, and you may find that it's a little bit taxing on the body. Like I myself was on it 3 times. It was a little taxing on the body, but like for some people, it's like okay, you could do a low dose of Accutane and it's totally fine. Other people just can't tolerate the medications, and the Accure laser works hand in hand just like Accutane. It works just like it. It's just without the other side effects. It's just basically, without any of the problems, and there's no downtime with it, which is awesome. So, you could just go do it, and everybody's doing it these days. Everyone's doing it for the summertime. Everyone's doing it for the summertime right now because they find that their skin gets more oily at that point, so they want to really get their skin better. And it's really popular because it doesn't cause much pigmentation issues that time too. Here in Bay is saying, hi, Dr. Qazi, would you do patch testing with laser like a Pico? Well, I wouldn't really need to, really. I'm not sure what I would do that for a patch testing. It was just instead I go really low with each individual spot. I'll just kind of like lightly use a laser there, and then we'll do like another round potentially in a month or so, make sure your skin's doing well, potentially going a little bit stronger now that it's more superficial, and we'll just keep on hitting it that way. If it's something that we need to do that way, that's how I would do it. But I usually don't do a patch test. I just go lower heat, lower energy, especially for the first few sessions. Anybody who does my melasma treatments know I go very, very low heat, low energy, especially early on, and then I could go up a little bit more. Let's see here. H-Dog is saying, I feel like subcision made my scarring worse under the skin, like it caused a big line of scar tissue. I've seen that actually before. I've seen that before from somebody who was doing some subcision on people, and it seems like they weren't using enough numbing solution in there, and it was basically just sometimes causing it to get like hypertrophic. Sometimes even the scar gets a little bit erased. So sorry that hadn't been happening. There still may be ways that we could improve that and fix it, but it is possible. I have seen that before. It may require steroid injections. It may require some other treatments to help with that. Tough to necessarily say without seeing you. Are injections still the best for keloids out there? SRT 100 didn't live up to the hype, right? Yeah, it didn't really live up to the hype, really. At least in my mind, it's not like there's nothing that really showcases that it's really worth it for the cost. To be honest with you, just the bread and butter, things of like steroid injections with something like 5-FU could work really well. I'll be totally frank and honest with you. I actually was surprised. I saw some people, the way they do the injections for keloids, it's really, really heavy sometimes. It's like they put too much sometimes in there. You could run into problems with it, or they just don't do enough. Their depth is not great. So sometimes it's really operator dependent, to be totally honest with you. The way that someone injects the steroids. So sometimes people say, well, it failed. I tried it so many times, nothing worked. But I've seen sometimes the way people are injecting, they're doing it like too deep, they're doing it too superficial. And that goes also for like, cystic acne too. It's definitely, of course, it's a risk when you do, you have like a pimple. By the way, if you have a pimple, we can always inject it with a little bit of steroid. But there's some people who go way too deep when they inject it. They go way too superficial when they inject it. And they just sometimes put too much. And so it's like, then people could run into problems. I'm not saying it's always like anytime you run into a problem, it's because someone made a mistake, but that's not going to help if you're making a mistake. If that makes sense. Corinne is saying, any recommendations for East Coast providers? There's very, very few of us in the world, to be honest. There's very, very few of us. Tick2 Tox is saying, do you recommend at-home red light therapy after CO2 subcision to speed up healing? I don't, because of the risk of post-inflammatory hyperpigmentation. So I don't with that. Let's see here. Xguric is saying, I did CO2, but the scars on my forehead are too deep and mixed with fine lines. What do you recommend? Well, you may have to do filler. You may have to actually break up the scar tissue. We undermine that really with a blunt cannula. And then sometimes you could put a filler. Usually I start with a hyaluronic acid filler, and that's usually what I would recommend. Sometimes you do laser. You could do also potentially, like especially for the black scars, you could do TCA Cross. But filler is actually underused in on the forehead. Really, it's amazing for the forehead area. Akira is saying, can you do V-beam or PDL after CO2 or TCA to hasten recovery of redness caused by said procedures? I don't love it, to be honest with you. I don't love doing it immediately right at that time. I think there is more risk of hypopigmentation that way. I usually prefer to do, I personally carry XLV. It's safer for darker skin types, I find. And I do that actually usually a few months afterwards. So I allow the skin just to heal. I know that some people say you could do it right away. I don't agree. I think you could run into more pigmentation issues. I think that it's not really worth it. Also, it's just like natural just to have redness as the skin is healing. That's just new skin. And so it's not something that I would particularly recommend. Let's hear this and that is saying, hey, doctor, my nose was red with pores on month 2 of Accutane and pores closed, but still red. Derm said it's not rosacea. It's tough because sometimes people will say that it's not rosacea because at that moment it's not rosacea, but then it turns out like someone sees someone else again and it's really, really classic rosacea. So it's tough to say, is it really, really not rosacea? If it's more just post-inflammatory erythema, then you could do what we were just talking about earlier, which is more like XLV could work out well with that. So we could do XLV, just target that directly there. Recentel is saying, hi doc, why Sculptra over Bellafill? So there's so much volume loss in this case. I want to just get a little bit more volume. And so what I ended up doing was I did Sculptra for this patient, but I absolutely could have done with Bellafill as well. It just would have taken a lot more, probably taken a little bit longer. James is asking, hi doctor, which laser is good for stubborn KP? I've tried everything, including Urea and AmLactin. So if it's really stubborn like that, then you may try XLV could work out well. That's a good option. You could also, I don't carry it, but you could try V-beam as also, that helps as well. Shamans is saying, do skin boosters work? Which ones do you think is good? If there's a quick fix, it could help out. It's not going to help enough for scars though, really. It's not going to help much for those scars, but it could help as a quick fix though. How much does this cost? So because there's a lot more volume loss, it could cost sometimes $7,000 to $10,000 for something like this. Post-inflammatory erythema. So yeah, we could do basically just like azelaic acid. And then if you have really stubborn areas, we could do lasers like I use XLV. Baokimi, how's it going, Baokimi? So let's see, she's asking, did you just say you didn't recommend red light therapy? I just bought one, so need to know to return it or not. Well, I wouldn't recommend it for you with your skin type, especially because we're dealing with, scars. We're working on lasers. You really are more likely to get hyperpigmentation. I found that there's a lot of risk with a lot of the heat there. And then after you do these treatments, you are more prone to getting pigmentation. It's just there's too much heat sometimes there. And we already kind of got you through the scar portion of things, and we didn't get any pigmentation issues. But sometimes with those red light therapies, it could cause that though. I'm sorry, what was used for these results? So this was a few different steps, Adriana. We did Taylor Liberator subcision in this case. We did ablative CO2 laser at the edges of the scar. I did TCA Cross for the boxcar scars. I did Sculptra as well for this patient. Worked out incredibly well for him. So you can see he's going to come back, go do a little bit more. In this case, we're going to be doing more some Bellafill for him. And then at some point, probably 3 to 6 months later, I'm going to do another round of laser as well for him. When he came in this day, I did a little bit more TCA Cross there. Fashion and Cootie saying, I'm 56 and randomly started developing acne and rosacea. What to do? Control that rosacea. Really, a lot of times it's about the rosacea. And the easiest things to start with are going to be like first making sure that there aren't things that are triggering the rosacea, like alcohol. Anyways, people should just cut back on alcohol intake anyways. It's really terrible for your collagen production, so cut back on that anyways. Spicy food, let's assume you're doing all those things. You may need like oral doxycycline for a short burst, and then you could do like a low dose form of that as well. And then you could also actually make sure that you're on some sort of antimicrobial like metronidazole, or you could do a triple cream as well. So there's a few options really. And if you need to, you could also do lasers. Would Pico laser help with PIE? It could potentially, but there's better lasers out there. Like things like I said, XLV could help. V-beam is a good idea. So all those are better options there. Val Kimmy, you're coming in 2 weeks. Look forward to seeing you too. Coming back for the second step over there, it looks like. What are the risks of, so Ernest is asking, what are the risks of subcision? So there's a few different things. I mean, it swells up quite a bit there. So there's going to be some swelling. Really that's the biggest thing. The other thing is really that sometimes is that like some of the patients really, it's so stuck and it's so severe that once we relieve some of that scar tissue over there, it could cause the face shape to look a little bit different, especially in this part of the area, because we lifted up some of the scarring. I mean, that looks good. Nobody complains about it. It always looks awesome for people. Just so you know that your face like is going to be a little bit different because you had it stuck at one point and you were robbed of like the way you normally should have looked. It was really taken away from you. Your acne and your scars actually just destroyed some of your collagen and some of your fat, and it was tethered and stuck, and we released that and allowed you to actually get where you could smile more naturally. It's no longer really pulling down anymore. So that changes things. I mean, it's a good thing. I mean, most people find that's a good thing, but that's a side effect. The other potential side effect, and I have seen it in other places where they've done subcision, especially in the lower part of the face, and especially when they combine it with something like Sculptra, for example, or Radiesse, you can get sagging in the lower part of the face if they use too aggressive of tools or they put too much volume in that same day. So I would not recommend that either. So those are some of the bigger risks. There's also, of course, risk of hematoma. Basically, that's blood collection in the area, a pocket of blood, and we may have to drain that or just allow it to basically get reabsorbed depending on what's happening with it. It could also get infected too. All low likelihood, low chances actually of these things. I don't really run into these issues really, especially after like the first week or so. These are things that really, there's ways of minimizing it, especially what I do with making sure that I don't use too much force. I'm really careful as I break up the scar tissue, and which worked out really well. Can you fly home the day of subcision and laser? Yes, you could actually. I think it's totally fine to be able to do that. It's just, it depends on how comfortable you are and making sure that you're comfortable with going on the plane. But most people actually fly in and fly out the same day. Some people just spend one night and just fly out the next day. And I don't expect you just to have to stay over here. It's really expensive for you to stay. And so I don't mind. I'm able to manage these things remotely. I'm okay with that. Thoughts on subcision with Nithya or Gori? I'm not familiar with that. I'm not entirely sure what that would be. I know that you've been asking that a few times, so I just have to tell you, but frankly, I'm not sure what that is. Does anyone know what that is? Nithya or Gori? I'm not sure what that refers to. Harun Bay is saying, what do you think of PRP for men's hair loss? It's always controversial treatment for hair loss. Do you think it's better than oral minoxidil? Well, it's definitely not better than oral minoxidil, but it's great as an adjunct therapy because it could get some more circulation over there, and then potentially it could prolong the growth phase of the hair follicles, which is awesome. But it's not something that I would recommend as just by itself. But you really want to make sure that you're on something topical, like topical minoxidil. Oral minoxidil is okay too, and of course finasteride. Of those, actually, I really do think oral minoxidil is excellent. Actually, it just increases hair growth elsewhere. And then PRP is awesome. PRP works really well for hair growth. I do it myself. It works really well. How many passes would you do with Subcision on rolling scars on a cheek? I feel a pass provider has done very little passes and I'm not getting my money's worth. I hear that many times people do 4, 7, 10 Subcision sessions. They do a single one with me. It's very, very different. It's not about how many passes what we're doing. I'm just making sure that each individual's bond that I need to break up is broken up. So it's very, very different, completely different from what you may have heard that you have to do multiple times. It's not true. We really can effectively break it up under a single session. It's just about how you do it and making sure that it's localized, it's precise, and you really can feel the tension of the scar and you're releasing each individual bond. There's people that aren't doing that, I'll tell you that. And sometimes they'll just jump right away into like using blades, and I don't do that either. I mean, blades are more risk. There's more chance of hematomas. There's just more prolonged swelling. So I don't do it that way. I usually do most of my work with blunt cannula. What's the best laser for PIE and PIH? Well, two separate things. So PIE is the red marks and PIH are those dark marks. PIE, I usually use something like XLV, especially in darker skin types. There's less chance of rebound pigmentation with that. PIH, I love Pico laser, so that's what I usually use. Hi, Miriam. How's it going, by the way? Miriam's saying, I don't break out anymore, but would I need a cure if I'm scared of breaking out from scar treatments? You could do even like one session of a cure. We could maybe do like lower heat, or I should say lower energy form of that. So I do that more for like oil production, and it's something to consider there for that. And good seeing you on, by the way. Shiraz is saying, hi, Dr. Qazi. I am South Asian, and I just did CO2 for rolling and boxcar scars. I'm getting Bellafill next. How risky is Bellafill due to granulomas long term? I think the actual number for Bellafill granulomas is like 0.02 like worldwide, something along those lines, like extremely low. It's really a matter of more like just like making sure the area around it's really clean. And as long as the patient at the time doesn't have like some autoimmune condition that's really hyperactive or so, potentially something like Sjogren's, you wouldn't want to do a scleroderma, extremely low likelihood. And I'm going to tell you something, 0.02 is very low likelihood. Is even low likelihood of, really like hyaluronic acid filler. I'll pull up the number actually myself at some point, but like this, if you look into it, it's actually extremely low likelihood. So I'm not saying that's impossible, but go to somebody you could trust, go to someone who's careful and clean. It's extremely low likelihood. It's not something I would particularly worry about. The bigger thing I worry about with that is really just that people have a heavy hand and they put too much in certain areas. I had a person that, I was trying to train, and this was like several years ago on doing Bellafill, and they were like putting so much product in the nasolabial fold, and it wasn't the right way, right depth, and just started like, they're ready to squeeze it. They're ready to squeeze that product right into it. And I was like, what's going on? She's just like, oh, that's how I always do it. That's how I always use filler. First of all, it's terrible practice even for hyaluronic acid filler. So watch the way that people do hyaluronic acid filler and watch how they're like shoving things, and they're shoving it over there. That's never a good idea. And then she's telling me that, you could turn like a cupcake into a pancake, something like that. And it's like, man, you don't want to do that with like a permanent filler. Something that's potentially permanent, like that's 20% of it's always going to stay there. And so it's just poor practices. Some people just have poor habits on how they inject, and you don't want to go to something like that, to be honest with you, especially something that's a permanent filler. So that's personally the way I would view it. Look at the way someone's doing it. It's more like you got to be really careful with the way you inject it. And there's some people who just don't respect the products they're injecting. And that goes with hyaluronic acid filler, that's with Sculptra, that's with Bellafill, that's with Radius, all those products. You'll see the way they do it. It's a very heavy hand sometimes. That's why I don't trust people a lot of times. It's like, I look at this like, man, I wouldn't trust it. I would not want to do this. And sometimes the aesthetic is just so off that like I just would never be able to do that. Let's see here. Can Subcision be done on a temple safely? Well, I could do it actually more for with blood cannula. But usually it's not as tethered as people think. So I've seen some people say that you do tailor Liberator over there. I would say that's really unnecessary for the vast majority of cases. I mean, I'd be really surprised if you need to. I've never run into a case where I needed to use blades over there. And I do so much for temple subcision, or so many temples in general. So I just never run into a case where I needed to use tailor Liberator subcision. I just do it with blend cannula. I'll tell you, honestly, I do think that part of it's because I was trained with using my hands so much. I use my hands. I can feel the skin really well with my hands. And you just have to do that when you're doing subcision. You got to feel it constantly. What about exosomes? That question I love to hear because it's like I'm open to it. At some point, if people can showcase that it works, I'll be happy to check it out and try it. At this point today, I can't recommend it. FDA has recommended against doing any injectable exosomes right now. So I would not recommend that there. Let's see, what was it? Is subcision really necessary before laser resurfacing? Not necessarily. No, sometimes it's not. Sometimes it's not necessary. I'm not sure if it's, necessary for a lot of patients. A lot of times they tell me that they thought that they were supposed to do subcision or they were told to do subcision before. But if you look at it, it's like one or two kind of scars like that. I probably wouldn't really push doing subcision like that. We could just solve that sometimes with just volume. It's not really pulled down enough to be able to do that. So I wouldn't really recommend that. Should I even get acne scar procedures if I still have active acne? Really control your acne. Really control that. So I would really control that first. Kirill is saying, my skin is like the left one. How many treatments do you think I would need? Well, it's tough to say. If you really do have this kind of volume loss, the thing that's going to lag is giving back that volume, because it depends on where it's at. This case, and actually in a way it was fortunate because it was in the mid cheek. That's an area that we could give a little bit more volume without worrying too much. Go deep, put that in there. That works out really well. But sometimes in the lower part of the face goes a lot slower because it's an area that you can't put too much filler in there, too much volume. It's going to get very heavy, very fast. And we don't want that. We don't want to cause that problem. So I would not recommend that. Let's see, where was I missed a bunch of questions. Why is phenol peel not considered in India? Most patients in India are going to be Fitzpatrick 5 or 6. Not going to be recommended for that because you could cause more hypopigmentation. That being said, there are patients that have done it, with I should probably start over. That being said, there are people who are 5 and 6 who have gotten phenol peel and they didn't run into long-term complications. But there's more of a risk for that. There's definitely more of a risk, and I'm not sure if you're going to be open to those kind of risks because that kind of hypopigmentation, it's possible that it could be permanent. Usually it's just a temporary effect, but it's possible it could be permanent. And then you may be bothered more by that loss of pigmentation, more so than you are with the actual acne scars, and that's a big concern. Zeppi saying best treatment for acne scars and the temple area. Sculptra, Radius, awesome ideas really for that. Really good options there. So I would highly recommend that. Volume replacement is really huge for that. Shamans is saying, why are ultrasound devices not used in acne scar revision for collagen stimulation if it's supposedly able to reach deeper depths than CO2? I myself don't use ultrasound devices like Althera. I never was like a big fan of it, to be honest with you, because it just didn't seem like it was helpful enough for what I need to do. I know Dr. Lim uses Althera for skin tightening. I haven't heard him talk to anybody about doing it for scars though. And I'm sure that if he thought that it was something for scars, he would have told us or told me at least that that's something that he uses as well. And I'm sure he would have talked about it on his many talks about how alt therapy is very helpful. And I haven't heard him say that. And he's somebody that does do, or at least he used to do a lot more with ultrasound. I'm not sure if he still does that. So I sort of have to defer more to people that do that. It's not something that I'm particularly interested in because I get great results without doing something that's sort of like unsure. Like alt therapy potentially could cause actually more fat loss too. Sometimes it's like things I'm concerned with, and it's just like I'm able to achieve these results without that kind of risk and that kind of complication. But maybe it's something worth asking him to see if you ever tried alt therapy for scars, see if it ends up helping. Miriam, I'll go into that more tomorrow with the Verteporfin. I'll be happy to go through that. If you could actually see if there's anybody that has body scars, I'm trying to get more people with body scars. If they can message us, I know some people sent it over more for keloids. Keloids, we're not going to be able to really go showcase that, because if you excise it, it's not going to really be able to show definitively if it really heals properly with that. So body scars, particularly people for surgical scars, if they have like a wide boxcar scar for whatever reason, all those good options potentially for something like Verteporfin. So maybe something to consider. But the other big challenge with Verteporfin is that it can't be in areas where there's too much tension. The chest area, I had some people that sent it over for the sternum. That's an area where there's a lot of tension over there. So again, areas that are kind of more kind of difficult to be able to do, but we may be able to do it and just see what happens with it for us, because maybe that'll be a way that we could showcase to people that here's, if Verteporfin worked over there, it could work almost anywhere then. There's a lot of tension right there, but we kind of are shooting ourselves in the foot because it's an expensive product, expensive to do the whole thing, and difficult to really be able to do it in areas where there's a lot of tension. It may not come like the best possible result for people. But if you know somebody with body scars, especially like I would say like the forearm would be a good option. The arm area over here would be really, really good. Sometimes that's an area that's sort of neglected. You could actually just consider something like that where we could actually excise a bit and then do Verteporfin study that way. So those who don't know, Verteporfin is just a theoretical idea. There's a concept that we could actually get scarless. If we excise the scar, we put some Verteporfin in there, inject it, we could hope that potentially it could get it so that the skin heals complete. And that's the hope. I've had some people who sent me some photos, though. I'll tell you, to be honest with you, I had some people send me some photos. They said that this is, this is what happened. Some people have actually reached out to me saying that they tried it themselves, they tried it elsewhere, and they're saying that it wasn't great improvement. But they also did it in areas where there's a lot of tension. I don't want to shoot ourselves in the foot for that kind of thing. So just to be honest with you, I have had some people that sent it, but it was unclear to me, why that spot was chosen, because there may have been areas where there's too much tension, and then you could get a bad result in that way. So hopefully I'll get to you guys' questions tomorrow. There was a bunch of questions here. I'll try to hit back on some of them tomorrow there. Kimmy's asking on here, she's asking, Dr. Qazi, what if I know someone with a scar, but they have tattoos in the area? So that's possible. We may be able to do that actually for that, because we don't want to use lasers. So excisions actually with Verteporfin could be a great idea for an area with a scar, and they try to cover it up with a tattoo. Or just for other treatments. We potentially could do it even for other treatments like subcision or collagen fillers as well. I appreciate everybody. I will be back on tomorrow.